Hello, it's me again. I'm here to review the Theracane. As a physical therapist assistant, a personal trainer, and an athlete, I think this is one of the most important products a patient or client can use. In fact, I use it so much as often a stocking stuffer for my family and friends. Yeah, I know, I'm kind of a dork, but I love this stuff. And being a physical therapist assistant working in different clinics, I've often requested them to purchase this because as a therapist, it's really important for me to not only provide a massage, but also to teach my patients and customers how to get relief for the muscle themselves. And with this unique design of this Theracane, and you can see the link below if you're interested in purchasing it, you notice these different nodules in different locations. They're used to hold and pinpoint where the area is hurting in the body. So the concept of a pressure point massage. So generally, what you're gonna do is you're gonna take the Theracane and you're gonna apply it to an area that hurts. As a person that used to have a desk job, I often have tightness in the neck and the upper and lower back. So what's really important is not to push it into the bone, because think about it, if you push into the bone, that's not really gonna help something. You wanna push into the muscle fibers in order to create the release. The concept is to push or to pull with this hand and push away with this one into the muscle fiber. Yeah, I already found it. And lean back so everything is relaxed. It's just your arms are creating the work. You're gonna hold this for roughly about 30 seconds. I highly encourage you to use a timer in order to do this. After 30 seconds, relax for about 30 seconds. And you're going to go to that exact same area and do it again. Again, with this hand, you're pulling away. With this hand, you're pushing. While this is happening, what it's doing is it's pushing into the muscle, which is, it's helping relax the muscle. But as you pull it away, it's reminding the blood flow, circulation, and oxygen in the blood to improve the blood flow into those areas to help it recover. You can use this Theracane in many different areas depending on what your needs are. Areas I often use it, again, the lower back. Again, rule of thumb, 30 seconds, release, 30 seconds again. I often have my patients walk a lap to see how that feels afterwards, because truly don't know how good it's working until you're trying to do functional movement in order to gain a better ability to recover. You can also use it into the buttocks area. Important if you're a single person or you don't have somebody that's there, especially at 2 o'clock in the morning when you don't want to wake anybody. Find the area where it's tight. Again, 30 seconds, release, push back in there for 30 seconds. Often when somebody is tight, the hamstring area is where it's hard to get to, but this tool is ideal for that. I even had some patients who have learned how to use this for lymphedema massage. Now, all this information I'm giving you, talk with your provider to make sure that this is something that's safe. This is generally something that can be used, but you can't, I don't want you pushed into the jugular because that's not gonna help you. Don't push it directly into the bones. Not in the private areas, none of that is good. But work with your provider for this. The link for this will be down below. This is one of my first videos, and I look forward to providing you more in the future. Thank you, and I hope you recover soon.